hand sanitize. I know I would have hand sanitized before I touched the patient too. So I have my Tegaderm, my Statlock, my Sani wipes, and my ChloraPrep, or I guess Skin Prep alcohol, and Skin Prep for the placement of the Statlock on there. I have my flush, I have a 20 gauge IV, and then my connectors, and my absorbent pad. I'm going to get to a level of the patient. So it kind of gets messy, so I'm going to go ahead and put the absorbent pad under you. Go ahead and relax. Hand sanitize. So I'm going to go ahead and put the tourniquet on and try and find a good placement. So when I'm looking for placement, I don't want anything that's movable. I want it to be most comfortable for you. Okay. The tourniquet seems to be the worst part. It's just a little bit of pressure. Thank you. And so when I'm looking for a vein, I want a good vein with no valves around. Valves make it really hard to keep a patent vein. I'm also going to make sure that you have a good radial pulse. If you feel me tapping, that's just trying to bring the vein to the surface. There's other things that I can do as well, and I'll have you pump your fist, apply heat, or have you put your hand off to the side here. So that looks like a good vein right there. I'm going to go ahead and release this. Get it cleaned up. And so with IVs, I'm going to go ahead and flush it after I get it inserted. If there is any pain associated with it, itching, or you feel any redness, if you see any redness, just go ahead and let me know, okay?
Okay.
So that's for 30 seconds. I'm going to do hand hygiene. Put my gloves on. Keep an aseptic technique. And everything ready for myself. Go ahead and prime my line. And since it's been out of the package, I'm going to go ahead and put it back in the package, and I'm going to clean it with an alcohol wipe. Okay. Tourniquet's coming back on. I'm going to go ahead and have you move your arm. Thank you. I'm going to go ahead and visualize, make sure the bevel is up. You're going to feel a little pressure. Okay, I see my flush. I'm going to go ahead and lower it down. I'm going to advance my catheter in, occluding the vein. Okay, at this portion, feel any pain or anything like that?
I think I'm good.
Let me know. Aspirate, make sure everything looks good there. And then 5 milliliters. And it seems to be going in just fine. Looking around, make sure there's no infiltration. Site looks good. Still feeling all right?
Yep.
Perfect. And I would have taken this off way sooner. here. I want to use the ChloraPrep to put around the skin so that way the stat lock stays in place. And from here, I've already labeled it with the dates, the gauge I'm using, and my name. The other thing I do is just put the time in. It was 11 o'clock, 1 o'clock, so $1,300. And so with this, we just want to make sure that if it becomes painful or it's starting to get red around there, you just let us know.
Okay.
Right. Okay then. The principle behind the Tegaderm is that way it keeps the skin so it and you want it kind of more up here actually, and I would get a new one at this point in time, but you want it to protect the skin around it and you want it open so that way you can see if there's infiltration. I'm going to go ahead and put the label here so that way they know and it's locked into place, and I can use my tape to lock that into place. Okay. And then I'll just clean up my mess here. I already put my sharps away. I'm going to raise my side rails up, give her crawl lights, lower the bed down to the lowest position, and then if you need anything, just holler for us, okay?
Thank you.
Mm-hmm.